On your surgery day, you'll probably have a lot of emotions, which is perfectly normal. Depending on your hospital's policy, you may or may not be able to have a support person wait with you. If having a support person isn't allowed, make sure to have a list of any last-minute questions you might have so you don't forget them. At the hospital, a nurse or staff member will check you in. You'll change into a hospital gown and underwear. There will be a space for your clothes and belongings. Consider leaving valuables at home. Then, settle in and get comfortable until your surgery team is ready for you. If you're feeling anxious during the wait, don't hesitate to express your feelings. They may be able to offer anti-anxiety medication. If you didn't meet the anesthesiologist before your surgery, they might have a few questions for you while you're waiting. If you tend to experience nausea or vomiting after an anesthetic, you can ask for anti-nausea medication to be put into your IV before you wake up. Once your surgeon and their team are ready, you'll be guided into the operating room. You might see your surgeon, but don't be alarmed if they're not there when you arrive. You'll lie on the operating table, and the anesthesiologist will likely explain what's going to happen. Often they'll have you count down from 10, and before you know it, you'll be waking up from surgery. When you wake up, you might feel a little groggy or nauseated. Depending on how many other people your surgeon is operating on that day, you may not be able to speak with them about how your surgery went. Before you leave, make sure you've urinated at least once, and any pain or nausea you're feeling is under control. Don't be alarmed if urinating is uncomfortable. You will not be able to drive, so arrange for post-surgery transportation and to have a support person with you. Most hospitals will require a support person to stay with you for 24 to 48 hours after surgery. The Endometriosis Network Canada is here to provide you with support and resources to navigate your endo journey. Remember, you are not alone, and support is available.